For a retired southwestern Ontario man, a piece of food lodged in his throat led to a new hope and a Canadian medical first.
Was eating lobster and it got stuck in my throat, so I had to go to the hospital to get it removed. I'm Gil Leger. I'm 72 years old and I live in Sarnia.
For two head and neck cancer surgeons at London Health Sciences Centre, Gil Leger's case offered an opportunity.
He's had those throat issues and subsequently was seen by a couple of different specialists, and one of the specialists had picked up on a concerning throat lesion. She did a biopsy and that showed cancer. And he was subsequently referred urgently to the cancer center where I met him. I'm Kevin Fung. I'm an otolaryngologist, or an ear, nose, and throat specialist. You know, I told Mr. Leger, look, you have an early cancer of the voice box. This is something that's treatable and curable. But at the end of the day, this is a malignancy. If it is untreated, you could have an airway problem and subsequently die of disease.
Gil was presented with a choice. The traditional approach was radiation treatment and possible open neck surgery for the tumor removal, or a new procedure never before performed in Canada.
You know, Dr. Nichols and I had very recently returned from training at the University of Pennsylvania, learning about transoral robotic-assisted head and neck surgery, essentially, you know, taking tumors out through the mouth using some special instrumentation and visualization without having to cut the neck open. We happen to have the emerging expertise to be able to do it with a fundamentally different technical approach, but maintaining the same cancer principles, and that is complete tumor removal.
He had a very limited tumor that had not spread to his lymph nodes, so that made him an ideal patient. My name is Anthony Nichols and I'm one of the head and neck surgeons here at Victoria Hospital. After meeting with him, we talked about it, that he would be the first, and we explained the risks and benefits, as well as the fact that he may need radiation anyway, depending on the results of his surgery, if there was any lymph nodes involved.
A month after being referred to LHSC, the history-making operation went forward.
He had the throat component of the surgery, which was successful, and we completely cleared the tumor. And then a couple of weeks later, he had neck surgery to remove the lymph nodes in his neck, and fortunately that showed that all his lymph nodes were cleared. And so he was solely treated with surgery, and his quality of life is excellent so far. He's able to speak well and swallow well.
London Health Sciences Centre is a leader in the field of oncology research and care. Transoral robotic-assisted surgery is advancing head and neck cancer treatment by allowing surgeons to see deep within the throat, accessing areas even around corners. It's innovative patient care that achieves better patient outcomes, and it's all driven by community support.
And where we stand today could not have happened without philanthropy and the generous support of donors. And also specifically the very first transoral robotic-assisted head and neck surgery in Canada probably could not have occurred without philanthropy.
Thank you for saving my life. And thank you for giving me more years to live, more years to enjoy. You know, there's no word. Thank you.